So as always, want to begin by updating you on our case numbers. As you've seen, just in a little over 2 weeks, we've seen a more than doubling of our average case number. Today, reporting 23,272 cases and an average of 23,503 cases. Remind you, just about 15 days ago, we were reporting a 7-day average of about 11,000 cases. And you may ask why the 23,272, maybe that's reassuring because it's lower than the numbers of 25 or even 30,000 that we reported earlier. I'll remind you that our Tuesday numbers reflect most of the day of Sunday into Monday, and then are reported Monday evening, and then we publish them on Tuesday. So these numbers a little lower than some of the other trends, but I expect tomorrow's numbers to be significantly higher, reflecting the normal amount of reporting that we see. We've done, as the governor alerted yesterday, and I've been watching, a significant number of increased tests. Nearly 300,000 tests reported yesterday, with a 14-day test positivity of 8.7%. Next slide. So our 7-day positivity is 10.1% higher than our 14-day positivity, essentially telling us that the last week has been even higher test positivity than the week before, a trend that we hope to reverse through some of our new actions. When we take a closer look at this 14-day positivity and we look at what it was just 2 weeks ago, 55% increase in that overall test positivity, another direction that we hope to turn around as soon as we can as a state. Next slide. We've been talking a lot more about hospitalizations and ICU capacity, really using these as metrics, the ICU capacity in particular as a metric to define our actions across regions in the state. And just a global perspective that we've almost 71% increase in the last 14 days for hospitalizations, our highest number ever for COVID hospitalizations at just over 10,500. And just in a day, having over 450 new patients hospitalized overall. That is not just new people hospitalized, but when you account for those who've been discharged with COVID, the sort of increased number of patients hospitalized is increasing rapidly. Similarly, for ICU capacity, we've seen a nearly 70%, 68.7% increase in ICU COVID hospitalizations over the last 14 days. Next slide. So the governor and I have talked to you a bit about the regional stay-at-home order. We have 5 regions across the state. These regions are what are known as the health officer regions. We have a number of different ways of segmenting the state for various purposes. And although I think we've fielded many questions about why these regions are, from a public health perspective, have some common features. They end up also illustrating how some of our delivery systems, our healthcare systems, work together across counties. Indeed, there's no perfect way to design regions in a state this size. So you've used something that has been used in other areas before. And as you look at this map, we see that certainly the southern part of the state, the Southern California region and the San Joaquin Valley regions are really seeing significant load in their ICUs from COVID, and therefore have a small remaining percentage of ICU beds open. As you move farther north, you see higher percentages of beds open, but even in those areas, some significant concern. And I'll remind you that 5 counties in the Bay Area have elected to go forward with the state's regional stay-at-home order framework, despite having greater than 15% ICU capacity. I think it's a recognition, I applaud this recognition, that the sooner some of these changes go into effect, the hope that the impact is greater and that we can shorten the time that these orders are in place. Next slide, please. So why a regional stay-at-home order? The fact is that transmission is now so widespread across our state that most all non-essential activities create a serious risk for transmission. It's also based on our past experiences in March when we flattened the curve. I'll remind you that in March, we didn't see a significant surge in this state. Our efforts were early, decisive. We all did it together, and we were able to, frankly, keep the curve down, keep it flat. We didn't see a big bump. In the summer, though, we did see a significant bump, smaller than the one we're experiencing now, and we saw how additional restrictions were the path forward to get through that. You might also ask, well, why the focus on ICU beds? Just to paint a bit of a picture for you, an intensive care unit bed is that bed that has such specialized staff and equipment, not because we don't have the equipment and beds enough, but we're worried about that staffing component. And on general hospital wards, where we have significant burden as well, but not nearly as much in our ICU. In the ICU settings, we know that nurses and respiratory therapists and other clinical leaders are not just hour by hour making changes to a patient's care plan, but really minute by minute. The need to monitor breathing machines, patients who are intubated on ventilators, the need to make sure that patients' kidneys are functioning well, that the heart is pumping enough blood to the rest of the body. Those are decisions that happen in real time and fast-moving decisions that we can only spread and stretch our ICU professional capacity, our nurses, our physicians, our respiratory therapists, our other healthcare personnel, stretch them so far before we're not able to deliver the kind of care Californians have come to expect out of our high-quality healthcare delivery system. So for that reason, we have taken a particular focus on the ICU, that we know that ICUs are not just called to take care of patients with COVID, but also patients with heart attacks, strokes, other serious conditions where that same minute-to-minute fine-tuning is necessary to get patients through a critical period onto stability where they can go and get care in our hospital wards, our general hospital wards, and even be safely discharged home. So our focus on that ICU capacity is one that we're newly focused on. We've always been attentive to it, but the critical focus on that now is because we are certainly worried that with so many patients with COVID being admitted, a predictable number needing ICU level care, that system, that fragile but important system, may be overwhelmed. And the goal of saving lives becomes threatened when that system isn't as robust and as strong as it can be to deliver care to as many Californians as need it. Our regional stay-at-home order is also based on successes from other parts of the country and their own actions moving through restrictions and building up to more nationwide closures. Next slide, please. So we wanted to highlight a little bit of the stay-at-home orders and the experiences in Europe. Europe has often been a few months or weeks ahead of where the United States has been, even as California has itself had lower test positivity, lower impact of COVID compared to other states. Europe is a bit in front of us, and they have demonstrated some actions that we can learn from. And part of our stay-at-home order really has learned from other experiences across Europe. I'll highlight a few here. Belgium, when they imposed a nationwide closure, the positivity rate in just 3 weeks fell from 21% to 8%, showing that if we do this regional stay-at-home order effectively, we can see in short amount of time a significant reduction in our own test positivity. England, when they imposed, after weeks of going through less significant restrictions, the decision for a 4-week national closure that included non-essential businesses, limits on gatherings, very similar to what we have as our regional stay-at-home order. They saw cases drop 30% overall, and in some of the hardest hit communities, a 50% decrease. Similarly, in France and the Netherlands, when they have done nationwide closures, they've begun to see drops in their own positivity rates. So rather than focused on the sector by sector restrictions, the top of our message is, as much as you can, stay at home. We know that it works. We know that we can bring transmission rates down and move back into the blueprint for a safer economy that we've been using for the large part of the last 3 months. Next slide, please. So as a reminder of what you can do in the regional stay-at-home order, Californians are important to do things like continue visiting their physicians' offices and their providers, buy groceries, get gas, pick up prescriptions, get a flu shot. Important to do that if you haven't already done it. Visit a local retailer or worship outdoors. Members of the same household are encouraged to maintain physical and mental health by safely using our outdoors, our parks, our beaches, our hiking and walking, bike riding with members of their own household. And we are also encouraging everyone, especially as we move into the December holidays, to keep connected with loved ones virtually. I think many of us experienced this over Thanksgiving. I know I did. We had my mom on Zoom much of the day, in and out with the kids, enjoying dessert as well with us. And it worked better than expected. It wasn't perfect. We know it was quite different, but it did allow us to connect with a loved one. My mom, who usually spends the time with us, but this time around made the decision to keep her safe, to make sure we didn't create additional chance for others to be impacted by our actions, and stayed at home. Next slide, please. I also wanted to take a moment to update you and clarify certainly what we're doing about travel. Again, overall, we want Californians to stay home, and that's statewide. We know that the regional stay-at-home order restricts this significantly in those communities and counties affected by the regional stay-at-home order. But even if you're in a county or in a community that isn't under the regional stay-at-home order, we ask you to consider canceling travel plans, discouraging others to come visit you. We know that's hard. We know that these are difficult choices to make, especially 8 or 9 months into our response. But we believe that these are important decisions to make to keep our communities safe. Hotels and vacation rentals should not rent to people coming from those regions under the stay-at-home order, except for essential purposes. Travel for our critical infrastructure business sectors that require employees to travel, spend a night in a hotel to do business, hopefully return to their homes as soon as it is safe and possible for them to do so. That is an appropriate use of our hotels and lodging. And then, of course, we've talked to you quite a bit about the need to quarantine and isolate. Counties across the state are using hotels to make this a safer, more feasible option for many Californians by helping secure a hotel room for those who need to quarantine and isolate to reduce transmission for their households, for their communities, and statewide. Next slide, please. So before wrapping up, I'll end with the way we always end, to encourage you to follow these simple acts that make a big difference for COVID and the flu: to stay home as much as you can, to wear a mask, to maintain your distance, to wash your hands, to don't mix outside of your household, and another reminder to get your flu shot. We know that California usually experiences our surge or our peak in flu early each year in January and February, but as we approach the end of December, we'll see cases increase, and that pressure not just on all of us to keep our households healthy, but also additional pressure on our hospital system as we see the pressure already from COVID is real, significant, impactful, and additive. So we want to do all we can. Because the flu shot is an additional tool in our toolkit, I encourage as many of you to consider getting it if you haven't already. Next slide. So it is true, we've done it before. Together, we can stop the surge. As these rates of transmission get stronger, I'm confident we will too, that our actions can make a difference. I know you're all tired. I know that it's exhausting. I certainly share some of that exhaustion as well. And I know that it's difficult to make the decisions that we're asking you to make. I know that many of us feel that this is getting, old and tiring. But with that said, I think the optimism and hope of vaccines coming around the corner, our ability to first protect the most vulnerable in our communities, those that are on the front lines of our healthcare delivery systems taking care of our sick, is a moment that we can't wait for any longer. It's coming soon. And so it makes the decisions of the day and our actions today even more important as we see the glimmers of a light at the end of the tunnel and the hope of protecting our communities, not just with these actions, but that additional tool of a vaccine in the weeks and months to come. So with that, I'll go to the